Hello everyone, today we're going to talk about methylene blue. Cue the trumpets, Dan. Trumpets, Dan. Hi, this is Dane with MD Customer X Pharmacy. Thanks for coming back. This video is the bigger video on methylene blue. In this video, we're going to visit the various benefits of low-dose methylene blue. We will do this by understanding how cellular processes function and how they're important for our health. This will provide the rationale for methylene blue's mechanism of action and implicated benefits. Then we'll pair those benefits with the available data in like clinical trials, studies, or reviews, literature. And during all that too, we will start covering like side effects and dosing and counseling points. But we do have a lot to cover. So hang on tight. Thank you. So as mentioned in the previous video, this was really synthetically made in 1876 by Heinrich Caro, I believe his name is. Let me just fact check that. Yep, Heinrich Caro. The small molecular weight of methylene blue allows it to kind of diffuse into tissues pretty rapidly. It's also hydrophilic and lipophilic, which means it's water-loving and fat-loving. So it's able to get into the brain. That's usually where lipophilic drugs or molecules are able to go, and then hydrophilic side can be other parts of the body. So this can do both, and then being small can diffuse into the tissue, which will be a big piece for all of the benefits downstream here. Another factor is it can gain an electron or really give an electron. So when it gives an electron away, though, it becomes reduced, and it's called leucomethylene blue, which it's actually colorless when it's leucomethylene blue. So it should just be really leucomethylene. But anyways, when it's reduced and it's leucomethylene, it's actually an antioxidant. So then it has this other property. So it can give an electron, and then it also becomes an antioxidant on its own. It helps the body as a rescue agent against like cyanide poisoning, carbon monoxide poisoning, malaria, UTIs. It has a promising trajectory in the field of psychology for depression, bipolar disorders. It can be considered an essential tool against aging, which we'll cover that too. It's being studied in different disease states like Alzheimer's disease. We can have some implications towards Parkinson's with it. Outside of its utility as an industrial dye, which it still has its own applications there, it's also used for surgical staining. It shows promise for foundational neural health, okay? And it's also FDA approved. It has numerous skin benefits, which we'll touch on as well in this video. Before we jump into how methylene blue can be so versatile to the human body, we do need to understand to some degree cellular functioning, at least a certain part of it, which methylene blue will be touching on. So our big takeaway for the next section is really what a mitochondria is, and then what necessary things it might need. It won't be all of them, non-exhaustive, but some takeaways from what a mitochondria does, and then that will help us answer some questions about methylene blue, or we'll be able to use that understanding to move forward and really put the pieces together of why methylene blue can be so dynamic for the human health and the health system. All right, with everything being said, I have a simple question, why do we eat food, okay? I mean, outside of like the pleasures of like, it's palatable, well, hopefully for the most part, and then the cessation of hunger. I mean, you have a few other factors, of course, too, like it can provide good bacteria for our stomach and overall gut health. So there's a biome there that food is helping replenish and quench. But outside of that, too, we use it for energy, right? We eat food to gain energy, but really how we're making this into energy is we're stealing the electrons from this food, okay? And we need those electrons because something called the mitochondria, which is in your cells, in your body, is a little factory that converts a few ingredients, including electrons, which is a big takeaway here, and oxygen, that's another piece it needs, to create something called ATP. Now, ATP, that is an acronym. It stands for adenosine triphosphate. That is what you could think of as the currency of the body. So, I mean, it's what's going to do all the transactions. well established in the biological community. ATP is necessary for muscle contraction, necessary for synaptic signaling, necessary for like intracellular active transporting, so transporting materials from one side of the cell to the other. It's necessary for DNA and RNA synthesis, so really recreating the roadmap for cells to be able to proliferate. There's more. I just don't have it on the top of my head, but understand that ATP is absolutely necessary for the cell survival and our survival, and we can't, the major source we get that from is the mitochondria. Funny side note, believe it or not, the keto diet, if done correct, does produce some level of ATP, which is kind of curious, but that's another video. For this video, we need to know that ATP is our end goal, and that is necessary for survival, and that is made from our mitochondria, and our mitochondria is in all the cells, and that needs a few other things, but bare minimum, it's going to need electrons, which we normally get from our food, and oxygen. So ATP being our end goal for our overall survival, need to get it from our mitochondria. The mitochondria is really good at making these. It does it in the inner mitochondrial membrane, so kind of like this inner membrane part of the, it's called an organelle, which is like, essentially it's like a little factory in the cell. But again, we need that for the ATP. So these 5 complexes, the first 2 complexes of these 5, which starts with food and really ends with ATP, is going to be complex 1 and 2. They're breaking down lipids, carbohydrates, they're breaking down glucose. They're making a few other molecules we won't discuss, but they are taking electrons from that because there's something called the electron transport chain that is a gradient or a flow. So you have complex 1, the electron transport chain is creating an electrical gradient that helps these other complexes keep going, where the 5th one creates that ATP. Again, complex 1 and 2, breaking down the food to collect electrons. Complex 4 and 5 is when it gets more, I guess, complex. Complex 4 does require oxygen in order to do its final process in order to get it to complex 5, which will generate that ATP for us. So again, the first 2 are creating electrons from your food. They eventually get to number 4. We combine that with oxygen. We move this to number 5, we get ATP, and then mitochondria does make waste products too, but the waste products are interesting. One of the waste products is water, H2O, but the other one is actually important for part of the video a little bit later and has to do with aging, but it's called reactive oxygen species. So essentially oxidized agents or free radicals. But they're called reactive oxygen species. The takeaway from what I was saying there essentially is that if we want the end game of ATP, if we want to be able to contract muscles, have our brain fire its synapses, recreate our DNA and RNA for cell proliferation, if we want to have intercellular transporting, and a few other great things, if we want to survive, right, we need ATP. And if we are going to get ATP, we need electrons and we need oxygen. So that's our takeaway, okay? Do you remember early on when I mentioned that methylene blue is used for cyanide poisoning? Well, cyanide poison actually, that destroys that first 2 complexes of the mitochondria, right? So you're not able to gather electrons from food. So that mitochondria dysfunction essentially prevents your body from getting the ATP and you die. Well, methylene blue, because it's hydrophilic, lipophilic, right, and it's small, it's pretty neutral, it can get right through into the mitochondria, and it actually bypasses complex 1 and 2. It delivers, because it can donate and receive electrons, being that auto-oxidizing agent, it can donate electrons to keep the electron transport chain going in the complexes and feed complex 3 and 4 to get the ATP from 5. So methylene blue, that's how it kind of helps with cyanide poisoning, okay? It keeps the mitochondria functioning even though half of it is really broken. And then on top of that, when a mitochondria is dysfunctioning, it has 11 sites that it can release that reactive oxygen species, which is very destructive, okay? So if you have a dysfunctioning mitochondria, it actually starts spitting out things that not only hurts itself, but it hurts other things. That can be a big problem, but you can neutralize them if you have something that is an antioxidant that again was that leucomethylene that I mentioned earlier. It's colorless, and it's going to neutralize those reactive oxidated or oxygen species that the mitochondria is making. So it kind of protects the mitochondria by keeping it going and neutralizing the waste products that it's having trouble with. It's very interesting. Hopefully we're painting at least some picture here, getting the foundational pieces we need, I think, for Methylene Blue to be in a more of a context of like the health benefits, because you can hear various claims for various things. And I think helping understand some biological processes or where it's happening or how it's working in the body can really help send it home to you, right? To make more conviction towards why it really is beneficial. So I hope we're painting a good picture here, and we're going to move forward now looking at, well, let's see what we're looking at. I got it right here. Our next piece is going to be, we're going to go into a study. This study was on, it was a rat model, okay? We do have human models as well. This was from 2013. So the reason I picked this one is because it's a serious matter. A lot of times in integrative medicine, which is wonderful, we want to support health. I mean, it's hard enough to even to define what health is as far as on a cellular or a biological level. Like, for instance, I'm 38 years old. Now, how would we measure what my body is? I mean, outside of just counting how many laps we've done around the sun here, I mean, are my metabolic processes of a 38-year-old? Are my genetic and DNA sequencing, has it been beat up as much as a 38-year-old's would be expected to be? So integrative medicine a lot of times does twofold. It tries to support health, which would be supporting your body from the bottom to what DNA needs, to how it transcribes it, to how it makes the proteins to create other parts of the cell, to what the cell needs, okay, to what you need to have your metabolic processes going, because you have multiple cells and they want to create things and have waste products, right? These are all part of health, and integrative medicine and supplements touch greatly on these. But this study I thought was neat because Methylene Blue does all of these things I just mentioned, but also like the cyanide poisoning and very acute serious matters is an unbelievable rescue agent. And here's why. Here's one of the reasons. So this study involved lesions in the brain. So essentially we had, I mean, there's going to be a few words thrown out here, but lesions in the brain or infarcts, it's going to result in dead tissue and hypoxia. So lack of oxygen leading to dead tissue in the brain. It is parallel to a stroke. So if you've had a stroke, or if we can paint a picture of what Methylene Blue can do in the setting of a stroke, which is a very serious matter, okay? So this study was randomized and double-blinded, meaning the professionals that were reviewing the MRIs or magnetic resonance images of the brains didn't know if it was a controlled group or the group treated with Methylene Blue. The group treated with Methylene Blue, it was found that it reduced the lesion size or the infarct volume by 30%, which is pretty significant. All right, I have this little graph here. As seen in the graph, Methylene Blue also sustained the decreased lesion size over time. The study also stated, and this is direct from the study, but during ischemia, so during like a loss of oxygen in the tissue, therapeutic approaches that buy time before recannulation via sustaining energy, ATP production in mitochondrial respiration. So recannulation is when they're going to redeliver oxygen to the tissue. But the study even says itself, verbatim, talks about sustaining energy, ATP, right, in the mitochondrial respiration. So that's a big ticket item we're trying to help keep up. This could help minimize ischemic injury and extend the treatment time window, okay? Cannulation being the administration of oxygen directly back in the tissue. After recannulation, it is also likely important to minimize reperfusion injury. So reperfusion injury is when they're delivering that oxygen. You can get hyperperfusion, too much oxygen. If the mitochondria are dysfunctioning, they're spitting out their own reactive oxygen species. So getting more oxygen will help them function, but also could cause more kind of oxidation, possible damage there. So we want to protect that as well. So what did all that jargon mean? Essentially, you know, in the setting of stroke, supplying oxygen to the brain tissue as soon as possible promotes the best outcomes, though resupplying oxygen in itself can cause some damage, such as hyperperfusion. And the study found that methylene blue treated subjects had significantly less hyperperfusion trauma than the control group. So that was another significant find. So what about methylene blue and aging? We've talked about methylene blue for cyanide poisoning. We talked about the mitochondria and what methylene blue is doing and how it's reacting there. But what about methylene blue and aging, okay? And we're going to touch on this from a few different angles. We're going to touch on it from the biological standpoint, from the mitochondria. We're going to touch on it from the brain aging, and we're going to touch on it with skin too, okay? But first up, there is an aging theory. So aging is kind of hard to define to some degree, but there is an aging theory called the free radicals theory of aging, which essentially says that free radicals more or less are the cause or demise of aging. I mean, there's going to be other factors too here, but if we follow that train of thought, the mitochondria, again, has 11 sites, as I mentioned before, to create reactive oxygen species. So those are free radicals. So a dysfunctioning mitochondria potentially can start just pumping out free radicals, which in the free radical theory of aging, free radicals are only just going to bounce around and damage everything else around it, okay? And it does make sense because, you know, when you're between the age of, like, let's say 20 and 30, you're getting hit with free radicals too. But you have a high level of mitochondrial function. Your DNA sequences are likely less damaged from extrinsic environmental factors too. So really, you're aging, but that's like the peak kind of youth window, right? So if we could do anything, we'd try to restore your biological variables back to that state. We can do that to some degree with bioidentical hormone replacement therapy, which we offer, but we also would want to approach this from supporting mitochondrial function. So how does methylene blue help with aging? Well, if we go on that theory of free radicals of aging, we want healthy mitochondria, and so we want to soak up that ROS, or the reactive oxygen species. Methylene blue, specifically the leukomethylene blue portion that it gets converted to, will do that. And then the other piece, methylene blue, will be delivering electrons in case there is any mitochondrial dysfunction there. So that's one way it helps with aging as an overall cellular process of aging. Hopefully that made sense. Comment if it didn't. During brain aging, it kind of follows suit that there has been a correlation between loss of ATP and neuronal loss or neuronal death. Remember, ATP being that currency for really cell survival to some degree. I mean, there's a few other pieces that do it, but you need ATP. So you need the mitochondria, so you need it to function well. So they've found that mitochondrial dysfunction, loss of ATP, has been more prevalent in Alzheimer's and in Parkinson's and in just brain injuries overall. There was a study done in 2008 with methylene blue in patients with mild to moderate Alzheimer's disease. Patients were given methylene blue, and there was preliminary data that initially showed an 81% reduction in the rate of cognitive decline in 50 weeks. So taking methylene blue for about a year for people with mild to moderate Alzheimer's, there was an 81% reduction in cognitive decline. That is a phenomenal result. And then it went into phase 2 trials with humans. These are humans. The patients showed improvements in both cognitive and cerebral blood flow. So why would that be important? Well, blood's carrying oxygen. Well, what do we need the oxygen for? We need the oxygen for the mitochondria and a few other things in the cells, but to make ATP, right? And we also need electrons. So just putting all the pieces together here. But it was nice that we have a concrete trial from 2008 showing significant improvement against Alzheimer's, right? That is great. Here's a hot one. I know a lot of people were curious about this. At least on the last video, there was a few comments related to, like, you know, turning into a Smurf with methylene blue in the skin. Now, you know, and curious too, right? Because the leukomethylene blue is colorless, but getting it to stay as leukomethylene blue could be a little tough. but there is a bunch of topical creams out there, and no, you're not going to turn into a Smurf. So, but aging, a lot of times is evident on people's skin, right? Whether we say it or not, we can see it at first glance. You will look at someone and decide at least if their skin seems old or not, and who doesn't want better or youthful looking skin? So does Methylene Blue help with skin? It certainly does. It does it from a variety of factors. When your skin is aging, it becomes thinner, less elastic. Some of the complexes even break down. Well, Methylene Blue is compared to other antioxidants in skin care like vitamin C and retinol. It was found Methylene Blue significantly outperformed in both promoting cell proliferation, finally said that word right, first go there, and reducing age-related markers. So why would cell proliferation be important? Because if the cells are damaged or broken down, we need that matrix of the skin to be healthy. So building a new cell, regenerating a new cell to hold that matrix up is going to help with skin thickness, skin elasticity. It's going to be less likely to look wrinkled or aged then. Methylene Blue also, this is just, the list keeps going with this medicine. It's unbelievable. But Methylene Blue is also UV absorbing. So broad spectrum UV radiation absorbing. It's just crazy. Like, what does this medicine not do? So it also has been shown to mitigate the damage from UVB DNA irradiation. So DNA being damaged due to UVB, Methylene Blue is protecting against that. So you get a couple different things. You get the antioxidant piece. It beat retinol. It beat vitamin C. So you get your antioxidant side of it. You get the support of the cell itself. This, skin is made of a couple different layers, a bunch of different cells in there. All have mitochondria. We need them to be healthy. So promoting cell health from within. And then it's also protecting against extrinsic. So intrinsic aging is the cell just aging on its own. Methylene Blue is helping protect against that. Extrinsic is outside factors coming in. Like the sun, it affects, it protects you against that too. So Methylene Blue, as far as skin goes, is protecting both intrinsically and extrinsically, and I think that makes sense why it beat retinol and vitamin C. And that link will be down below. It might be a link to a review that has a reference to the study. A lot of these studies should be available on clinicaltrials.gov. Otherwise, the reviews that reference the studies would be, you can find them on pubmed.gov. So all this is public information. You just got to look around. But some of the links to the references or claims that I'm stating might be in a review where you have to go to the actual study from their reference, okay? All right, this next study is a pretty cool study that I mentioned as well. This is the one where, in the other video, I just very compelling. It says 1 hour after. So they studied 1 hour after taking an oral dose, because a lot of the FDA-approved stuff is kind of IV, but this can be given oral or even as a troche, something you put in your mouth. You just let it dissolve in your cheek. But anyways, they did 1 hour after oral dosing of Methylene Blue to see if it helped enhance memory, enhancing neural correlates, and sustained attention. So short-term recall and focus is how I say it. But let's get into that one a little bit here. So this study had a limitation in the sense that it wasn't a big population, or like they didn't have a big group, a big size for the test. We call them arms, like a control arm. And but you kind of get that, and they even say that in the test too with MRI imaging. It's hard to get a lot of people because they really have to set up the different arms, control versus variable, in very consistent manners, so there's no like lopsided arm. So it was people 22 to 62 years old. They tested them for like intelligence to some degree, gender, all the demographic pieces that they would want, and tried to marry the two arms to make them as close to equal as possible. So that was at least something that is helpful, so we can look at the evidence here. And you always want to look at limitations in studies, but this one, although it's small, I think is pretty reasonable. So it may not seem like a lot, but they found that Methylene Blue was associated with a 7% increase in correct responses during memory retrieval. So that is statistically significant. There's a few other things that were statistically significant, but they have like MRI verbiage for the brain and just a lot of brain terminology. But again, they found 1 hour after dosing it an increase in that short-term memory and focus. And the link to the study will be in our link below. I mean, all this is very compelling stuff, in my opinion. We've talked here now about kind of serious acute situations, cyanide poisoning, lesions, or potentially what a stroke would be like, and how methylene blue can help. Your time window for reperfusion can help mitigate damages from reperfusion, can lower the lesions by 30%, how it can reverse cyanide poisoning, how when it comes to skin, it's got UV protection, so it's protecting you from the outside environment for aging, but also from the inside, the intrinsic. How it's doing that, remember, is from the cellular level in the mitochondria. That same kind of mechanism of action in the skin is skin is actually helpful for against brain aging. So it's a neuroprotective agent because remember the mitochondria are creating those reactive oxygen species, and the brain actually consumes 20% of the body's oxygen at rest. So your neurons need mitochondrial respiration. So neuroprotective because of what we taught you with the mitochondria. In Alzheimer's disease, for instance, there's this amyloid plaque. It starts as amyloid peptides. Methylene blue is being studied against that too. I talked about a study there, but to go in the weeds, how it's doing that again is through the mitochondria functioning, and it's going to help the mitochondria survive. I guess those amyloid plaques or amyloid peptides, beta amyloid peptides, can get stuck in the mitochondria in Alzheimer's, and that can help to cause mitochondrial dysfunction. So we can see why methylene blue has a good place there too. I'm sure there's other reasons. So very compelling stuff. Haven't spoken about any dosing though, or the hermetic property, right? So the hermetic property of methylene blue, what that means is that low doses it acts one way, at high doses it acts another. There's something called methemoglobinemia that is treated with methylene blue, but at high doses it actually causes it. So it's literally the exact opposite effects. So, you know, what defines a low dose? So there are just numerous studies out there, and they're all doing different doses, but there is kind of a consensus among the healthcare community for what dosing should be based on the safety profile that this has. It's been out, you know, again, for over 100 some years, so we've gotten a good track record, a good take on it. I'm kind of going to reference someone called Dr. Bean. He's associated with the FLCCC Alliance, which is a wonderful protocol that they kind of developed in the midst of the whole COVID thing. They were pioneering dosing ivermectin appropriately against COVID, and they still are doing integrative medicine work and even repurposing medications appropriately, in my opinion. So Dr. Bean did a video as well, and he was referencing a few studies, but his consensus was around 1 milligram per kilogram is a safe dose. There is a cross-reference from someone named Dr. Scott Schur, who also took a look at all these various studies, and seemingly 0.5 to 4 milligrams per kilogram seems to be an appropriate low dose. So that would be what we define low dose as. So low dose, 0.5 milligrams per kilogram to 4 milligrams per kilogram, but this is routinely used in intravenous administration, or IV. So how would oral dosing work? Well, I mean, you can take, the two nice things is 0.5 to 4 seems to be a good window of dosing, milligrams per kilogram. There was a study that did, they were trying to do essentially 138 milligrams in a day, and that was via IV, but these patients in the study were going to be given tablets, so they used 60 milligram tablets 3 times a day, so that equates to 100 milligrams. And they said that they used 180 because of their estimates on bioavailability, meaning if you get IV administration of methylene blue, it's likely to be absorbed a little bit better than oral dosing. So if we're trying to hit 1 milligram per kilogram, say you're 70 kilograms, there's 2.2 pounds in a kilogram, so you could do the math. I don't want to do the math on the fly, but it's like 154 pounds, I think. Maybe quote me a comment if my math was right there. But say you're 154 pounds, and so you're going to need 70 milligrams in a day. So oral dosing could potentially go up to maybe 90 milligrams. That might put you at like 1 milligram per kilogram, 1.1 milligram per kilogram, whatever. You know, is it equivalent to the IV dosing? It's going to be much more closely equivalent. And there's just more data out there on IV, but that's one way you can do the oral dosing. We also have the troche. There is a membrane under your tongue called sublingual, which you could put there and get more of it into your system, although some of it's still going to go orally. But because we have the 0.5 to 4 milligram window, it's more than safe to dose it orally instead of IV. So you have to worry about the hormetic properties, meaning it starts working the opposite if you get too high in dosing. But one of the other concerns with methylene blue is it's in the class, or it acts as a monoamine oxidase inhibitor. So MAOI is the acronym there. But what a monoamine oxidase does is it breaks down serotonin and norepinephrine in your brain. Those are neurochemicals that help with like pleasure and energy. Antidepressants routinely, they're called SSRIs and SNRIs. Those are big commercially available ones. Those actually are helping keep those neurochemicals up in your brain and letting you not use them up as quickly, okay? So, and MAOI is doing the same thing. So methylene blue is somewhat of an antidepressant. And that's why it might have promising trajectory in the field of psychology, used for bipolar disorder, potentially used for depression on its own. But when you pair methylene blue now, the MAOI, with an SSRI or SNRI, we're getting twofold. And so it's very rare, but potentially you could get something called serotonin syndrome. This is muscle clenching. This is just a complete cardiovascular collapse. Could be fatal. Extremely rare, not anything you need to worry about per se, but whenever something could be that severe as an outcome, we always need to mention it and use caution and be advised about it. The other piece, so, is MAOIs also inhibit, so they're inhibiting monoamine oxidase. Monoamine oxidase is also breaking down something called tyramine in your body. So you don't get too much tyramine buildup in your blood, because we don't want that in your brain, because tyramine can also displace those neurochemicals and send your brain into a chaotic mode called tyramine-induced hypertensive crisis, So tyramine-induced hypertensive crisis is kind of similar to the serotonin syndrome. We're going to have a cardiovascular collapse there. But it's not going to be as acute. So in mild forms, it can just be higher blood pressure, but it can get extremely high and lead to stroke or some other poor outcomes, let's say. So how do we mitigate against that? So I'm not saying anybody who's on an antidepressant can't take methylene blue. It would just be something where the provider would want to monitor, starting very low dose, let's say, and then monitoring your blood pressure, right? But then certainly this is the dietary piece. So if you're on an antidepressant and you would want to use methylene blue at a low dose, we need to at least eliminate the foods that are high in tyramine. So this means fermented foods, smoked foods, pickled foods, aged cheeses, sauerkraut, although it would take a ton of sauerkraut to make anything happen. But, you know, why add more fuel to the fire? You know, if we have methylene blue and we have an antidepressant, those are both heading towards keeping a lot of those neurochemicals there. So we don't want that tipping point with all of a sudden we eat a bunch of smoked food one day at a party, a grill out, and then boom, your blood pressure goes out of control. Yeah, could lead to a poor outcome. So don't want to scare you, but those would be some of the cautionary things we're going to throw your way about methylene blue. But again, awesome safety profile at a low dose. I still, in my professional opinion, think someone on an antidepressant can still take low dose naltrexone, just needs to be monitored or supervised by a provider. The people that cannot take this medicine, though, would be someone that is pregnant or someone that is breastfeeding or has breastfed in the last 8 days. I hope this video was helpful for you for educational purposes. This is not intended to diagnose, treat, or cure anything. I am a pharmacist, but you do need a professional provider to start, stop any sort of medications, okay? Thank you again for your time. Can't wait to talk to you guys again. Take care.